So
Hey,
David is um, a father of two daughters. He started advocating for parental rights and the protection of children once he saw another friend of all of ours, Carolyn Burjoski, who was canceled at the Waterloo District School Board in January 2022. David has delegated multiple times at board meetings, and he gained viral attention for exposing the methods and policies that are taking advantage of vulnerable children. He has a podcast called Beyond the Rift on YouTube and has been a featured speaker on national news, on a million march rallies, calling for parental rights and the protection of our children. David, it's
Shannon,
good.
thank you so much for
It's
having me
great to
here.
see you. I'm glad to have you, and I'm going to give you the floor. Do you need screen sharing?
Absolutely. I'm just going to enable the screen over here. I think I have a screen sharing.
Okay,
Can you
great.
see that?
Yep, gotcha.
Excellent. Yeah, my topic today is the school to medical pathways that are currently happening in all the school boards, basically in Ontario and in Canada. I'm going to be using the Waterloo District School Board in our region as an example, but you can apply this to your school board in your region because chances are it's probably the same. And I think the problem is bigger than people think, and I don't think a lot of people see the documentation that's happening. So I'm very excited to share with you. I'm going to be reading just their words today. If you're just listening to this, I highly encourage you to go back and to just read the slides that I put up because a lot of the information is on the slides, and I'm going to be just showing you their documents and their policies. So you have to see it with your own eyes, just so you can see that what I'm saying is true. So let's get started with this. The school to medical pathway, I'm going to break it up in three stages. Stage one, the school boards educate and they normalize child sexuality and gender talks. And the school boards also data mine student demographics. Stage two, the school boards invite activist organizations to help vulnerable students. And these activist organizations educate students about medical treatments and lifestyles. And finally, stage three, students are prescribed psychological therapy and drugs, and students are prescribed body modification surgery. So if this is hard to believe, let's just go through and see what the school boards do and how they're involved. So first of all, the school boards are totally on board with socially transitioning your kids. They spend a lot of days at school celebrating days. I calculate it's about 30% of the days. You got June, which is Pride Month. You got September, October, which is History Month. Those are two full months. Then you have Spirit Day, International Pronouns Day, National Coming Out Day, Trans Visibility Day. They even hijacked Women's History Month, International Day of Girl, International Women's Day. They advocate for equity for women, and that's basically allowing men to go into their spaces. They also hijacked World Mental Health Day as well, basically celebrating the same things. So I'm going to hijack World Mental Health Day and talk about it again and bring true awareness to what is actually happening in the schools. So a lot of days are spent at school talking to kids about it and just kind of normalizing it. They also invite staff and teachers. They've invited a drag queen at schools. I don't know why they thought this was a good idea, but anyways, this is all off of their Instagram, right? So they invite people to basically talk about their sexuality and how happy they are, and their Instagram obviously is focused on students as early as age 4. Basically all students. And they do various activities too with the students. You can see in the bottom right-hand corner, Director Jiwon Chanika wearing a pride. They're basically painting murals, painting flags. They're doing everything that they can to progress this pride thing. They're inviting special guests to talk about how empowered they are with their sexuality, of course, around minors, which is the concerning part here. How does the school keep this going? It's enforced cooperation. So this happens through policies and procedures, basically undermining parents, anti-LGBT bullying and discrimination. They co-opted human rights and anonymous reporting. You can see in the bottom right-hand corner, Waterloo District School Board, they have an anonymous bullying reporting tool, basically to keep people in line who don't agree. clubs and equity officers enforce school values and celebrations. So a lot of these clubs at school, they'll have like an LGBT club. They say it's student-led, but it's heavily staff-led, leading the students where they need to lead. And they basically try to raise awareness and constantly control what people think and what they consider bullying. Obviously, books and learning material. We've had Pierre Barnes as well talk to you about the books that they have as well, and just the learning material that they have in the schools where they're trying to get teachers to not think of students as in boys or girls, but to think of them, to say folks instead of hey boys, hey girls, stuff like that. Obviously, deflecting criticism and public statements. The first time I asked the school board who's interested in the sexuality of my daughters, they ended up releasing a public statement open letter. I thought it was embarrassing for them because they also included a bunch of documents that I criticized. But hey, it's for you to read as well. So they'll try to defame people. We have Carolyn Burjoski. She's undergoing the defamation lawsuit as well. So that's the kind of stuff that they use to keep people in line. Here's Administrative Procedure 1235. A lot of the school boards have something basically exactly the same. The first line over here, a school shall not disclose a student's gender status to the student's parents or guardians without the student's explicit prior consent. This is the problem. They don't let parents know if students are transitioning at school. Of course, they encourage social transition. And they also say over here in washroom access, students' sole identification is the sole measure of their gender. And then students have the right to a safe change room that corresponds to their gender identity. Basically, boys can go into the girls' washrooms and change rooms if they feel like it, and also playing girls' sports. I don't think they really ask the girls how they feel about that, but hey, discrimination goes one way over here, and nobody cares. And I bet, if a girl complains about a boy being in their private space, I think the girl will be getting in trouble for that. So we got to stick up for our kids. And this is the leadership. These are the trustees and the director. They're kind of pushing this. And I'm sure at your school board, you have leadership that are definitely pushing these kind of policies. So I first got started in this after Carolyn Burjoski got canceled at the school for showing the kind of books that are available to minors, honestly, in junior kindergarten. I thought it was crazy. But right after they said they have a survey. It's Have Your Say survey, and they were basically looking for questions to see what direction the board will go forth and implement. So they're focusing a lot on identity, and they also said they're encouraging students in grade 4 to 12 to participate in their survey. That's the information that they say. Now, what they actually did is they asked students as early as age 4, not grade 4, age 4, and they asked them, what is your gender identity and what is your sexual orientation? So, I saw this survey as well with my daughters, and this is what sparked who's interested in my daughter's sexual orientation and gender identity over there. I don't know these adults, and these adults are thinking that having these conversation with my girls and with kids, my girls were 7 years old, one of them at that time, and they thought this is an appropriate thing to ask students according to their survey as early as age 4. This is ghoulish to say the least, but hey, here we go. They also have a safe, caring, and inclusive survey. I saw that on their Instagram. This is student data mining, basically to determine vulnerability, and that way they can justify to bring in organizations to talk to the students. So they'll want to get a grasp on demographics. Are you a girl? Are you gender fluid? Are you gender queer, intersex, non-binary? I mean, completely inappropriate. I remember a time when sex and whatever was not up for debate. It was none of their business, but they are very interested. And the troubling part is they also want to know how you're doing with your family, right? And how you're doing with yourself. They want to see how vulnerable you are. So they'll have questions like, in general, I like being the way I am. I feel unhappy a lot of the time. I feel upset about things, and they want to know, do you read English? Were you born in Canada? Was your mother born in Canada? So they're asking kind of intrusive family questions, how many parents are maybe kind of in the house, etc. how stable is your family or how unstable are you? You can look at it both ways. Stage two, this is when they invite the activist organizations to come in. And again, I saw this on Instagram, OK to be me, right? It says it's a local organization that provides support services for lesbian, gay, bisexual, transgender, or questioning kids and teens in the Waterloo region. All right, kids, that kind of grabbed my attention. Um, and teens, obviously, everybody's a minor over here. So I'm going to use OK to be me as an example for what I'm about to tell you and just show you the kind of support services that these organizations offer. There's a lot of organization. They're even listed on Waterloo District School Board's website. We have EGAL Canada. They're also looking to intervene, or I would say interfere, in Carolyn Burjoski's defamation case by basically policing language and telling the judges if you don't police the language, the public is going to be very upset. There's also a bunch of other ones. Just look at who they're targeting, right? Safe exploration of gender for children, again, children, gender diverse children and teens, gender spectrum, GLSEN, LGBTQ inclusive, K to 12, right? Kindergarten to 12, LGBTQ. I mean, I don't know who's interested in the sexuality of a kindergarten. Apparently, this organization is, right? LGBT Youth Line affirms and supports experiences of youth 29 and under. 29 to 0, basically, across Ontario. Very questionable behavior, I would say. OK to be me is up there. I'm going to focus on them. You also got Spectrum, serves and affirms and supports the well-being of LGBTQ individuals as well. So let's talk about OK to be me. This is a poster that they have, Pronouns Matter. Our pronouns are core to who we are. It's basic respect to use a person's correct pronouns. I would say it's basic respect not to lie to a person as well and to just be truthful. And, the whole movement is kind of narcissistic, very centered around you. And I think it's important just to be truthful to people and to let people know if something's not true, don't just go along. You're not doing people a favor. That's not basic human respect to lie to them. That's lying to them and being dishonest. They said instead of using words like as he, she, use they. Instead of son, daughter, use child. Boys and girls use kids, friends. Ladies and gentlemen use folks, colleagues, everyone. I've mentioned this before. This is the kind of language they're trying to basically remove men and women from the equation. And yeah, this is the kind of poster. If you look online on their website, they talk about youth exploration transition, kind of gives you you got to kind of dig a little bit deeper. They say like ages 13 to 18, they're having like seminars. This is a group once a week. They say it's not psychotherapy and it's educational, not meant to treat any mental health issues. And I actually agree with that. They're not treating any mental health issues. They're actually affirming them and making them worse. And that's kind of a concern because, I hear from these people all the time, including the director, these people are at risk of depression and suicide. And it's crazy to me that under their leadership and under these organizations, the amount of suicidal kids have increased. And yet, seems like nobody's taking this seriously and wondering why at-risk minors are going up under their leadership. Very questionable behavior for sure. Here's another pamphlet that's very interesting. This is accessing gender affirming care. So now we're going to get into the details on how these organizations working in cooperation with the school boards, how they basically funnel kids. So basically the school boards, they're serving the kids. They want to know who's vulnerable. They're doing all sorts of promotional, celebratory days as well. They invite organizations to talk to the kids. And, if you want to access gender affirming healthcare, OK to be me will tell you what you need to know. Family doctors can diagnose gender dysphoria and provide hormone replacement therapy, give referrals for gender affirming surgery. Some doctors may want to consult with mental health service providers, but that is not required. Crazy, the bar is so low. You don't even need a mental health service provider to get this. Some doctor may want to refer to an endocrinologist or transgender clinic, but that's also not required. If your doctor would like further training on how to support patients looking for gender-affirming care, they can visit Rainbow Health Ontario pages below. We will be visiting those ourselves. Let's see some suggestions for doctors. It's okay to request to record your conversation with your doctor. It's okay to bring someone with you to your doctor appointments. It's okay to advocate for yourself or have someone advocate with you. It's okay to leave the room. In other words, it's okay to coerce your doctor and force them into giving you recording that conversation to make sure that what you're getting is the healthcare, right? And you don't need to have a mental health service provider. None of that required. You just need to force your doctor to basically do it for you. So they have a bunch of helpful links, and indeed they are helpful. We're going to be going through some of these links over here and just see what kind of documents these people make available to kids. Like I said, this is from OK2B Me. At the bottom, you can share this leaflet with your doctor. All right, I'm going to share it with you right now. Trans-related surgery, TRS, frequently asked questions. Who is considered a qualified healthcare provider to assess me? And it says a healthcare provider can be a physician, nurse practitioner, registered nurse, psychologist, registered social worker with a master's degree. I mean, the bar is so low, right? And qualifications can be received through Rainbow Health Ontario, WPATH, which obviously they're under investigation right now, or maybe they should be under investigation with the WPATH files, right? So, and then this is the sad part, in order to receive upper surgery, specifically chest surgery, you need one supporting assessment that has to be from a qualified physician or nurse practitioner. I mean, the bar is so low, you can basically just ask anybody, just ask a nurse to fill out a form for you and they'll remove your breasts, right? Like the bar is incredibly low. And I don't think people realize when people lie to you and they say, oh, people don't actually do this, this is right from their documents. I'm reading to you exactly what they say. Lower surgery, that's genital surgery, says you need two supporting assessments. Thank God. One assessment from a qualified physician or nurse practitioner, again, bar is super low, and a second assessment from a qualified physician, nurse practitioner, psychologist, or registered social worker with a master's degree. So you basically, the bar is so low, you can just walk right over and remove your genitals, right? This is how easy these people make it, right? Another link in that is this guidelines for gender-affirming primary care with trans and non-binary patients. Over here in this guideline, they talk about the effects of feminizing hormone therapy. They give you the formulations and recommended dosages of anti-androgens and estrogen. They say the goal of hormone therapy is in trans feminine patients is to reduce the endogenous effects of testosterone and is to induce feminine secondary sex characteristics. All very ghoulish, right? We're all looking at the same information here. Some people are giving the thumbs up saying how empowering this is. I'm looking at this and it's like, what are you guys doing? Basically, very ghoulish. And like I said, they're targeting minors, right? Just more information over here. This is a massive document, by the way. I have binders with this stuff, the effects and expected time course of feminizing hormones. They just give you a visual in there in case you wanted to see it all. The hormone monitoring summit for trans feminine patients. Now they get into a lot of details. And like I said, this leaflet is made available to students who want to chat with their doctor. Another link in this leaflet, guidelines for gender-affirming primary care with trans and non-binary patients. Oh, look at this. Questions may arise around the capacity to consent in individuals with cognitive or developmental disabilities and significant mental health challenges in younger patients. Since there is no specific age determining when an individual is eligible to provide consent for medical interventions in Canada, it is determined on a case-by-case basis at the discretion of the provider. If there are persistent concerns regarding a patient's capacity to consent, a referral to a psychiatrist with experience working with trans people may be helpful. I just want to bring to your attention since there is no specific age determining when an individual is eligible to provide consent, right? This is where you get into mature minors. They can provide consent. Again, let me know what you think of these capacities to consent and these documents that, kids are have access to. And this is the kind of stuff these organizations are pushing onto the kids. Here's more stuff. Formulations and recommended dosages of testosterone for masculizing hormone therapy also gives you the cost as well. And very convenient for them. They also have an appendix and they provide you with a bunch of forms. Just in case you wanted to do this, here's a sample request for an unlisted drug product, testosterone as well. Make it easier on your doctor when you record that conversation as he fills out the form. Hopefully they don't give you too much of a heartache when they say maybe you shouldn't be doing this. Here's another link from that OK2B Me document, Standards of Care for the Transgender and Gender Diverse People, version 8. Thank God they're at version 8. Statement 6.1. We recommend healthcare professionals working with transgender and gender diverse adolescents requesting gender affirming medical or surgical treatments inform them prior to initiation of treatment or the reproductive effects, including the potential loss of fertility and available options to preserve fertility within the context of the youth stage of pubertal development. In other words, chances are we're going to be sterilizing the kids. Or anybody doing this. So we just need to let them know about that and provide options. And if you've talked to any activist, they'll tell you puberty blockers are completely reversible and there are no effects. You just go back to normal once you stop. The medical intervention is stage 3. Children's Hospital of Eastern Ontario, CHEO, they say over here, we accept referrals directly from school guidance counselors and teachers and community partners, right? Is OK2B Me a community partner? They probably think they are. Healthcare providers, maybe they think they're that, like your family doctor or pediatrician. They'll basically recommend you straight from the school. It seems like school guidance counselors can do this for you. Over here in Waterloo, Trans Health, they have a bunch of qualified healthcare providers, physicians, nurse practitioners, registered nurses, psychologists, just waiting at your beck and call to do these operations. You have OK2B Me, KW counseling services, they'll give you therapy, affirming therapy, saying, yeah, what you're doing is good. Get in there, let us know if you need a note. And over here, I have underscored in orange is support for families, trans fam, youth ages 5 to 12, and parent peer support. 5 to 12. Man, that's crazy. The age is just getting lower and lower. These people are just targeting kids. Here's another one. This came up in a podcast I had. Get Real Movement, Born This Way, Gender Joy. Get Real Movement was not on that list of activist organizations on Waterloo District School Board, but they do come to Waterloo District School Board. They have come. And look, they sell gaffs. A gaff is made to be worn either with or without a tuck, and it helps trans femme folks or anyone with a penis to achieve a flatter, more gender-affirmed look. You can buy one for $28 to $69. Breast binders to press down one's chest tissue or breast down, helping you achieve a flatter look, right? Packers, which is basically a plastic penis. You can buy one. Breast forms, trans tape. This stuff is, I don't know what other word to use other than degenerate, but yeah, you have these organizations going to the schools, right? The schools invite them, and then they just take the kids from there and they'll sell them on a road to medical therapy or this. So who are the enablers in this? Well, obviously the school board trustees and leadership. The Ministry of Education sits idly by. They obviously know everything's happening, but they're not doing anything. The teacher unions have come out in support of the activism. We saw it last year with the Million March for Kids protest, where the unions basically sent out a message to all their union members to come out against parents. You have the Human Rights Commission, which was co-opted. You have the political parties. You have obviously the activist organizations that I talked about, city councilors. Speaking of political parties, this is not a Halloween thing, but you could be mistaken for that. Remember when the NDP, Kristen Wong-Tam, had that conference with I don't even know how to describe this photo. You just have to see it for yourself. A very interesting group of people over here. Well, I just wanted to let you know, she actually put out Bill 42, an act to establish the Gender Affirming Healthcare Advisory Committee. So this NDP lady, she says, they're basically looking to include the following members for gender affirming healthcare, which is what I've been talking about. Number one, youth, crazy. Seniors, Indigenous people, people with disabilities, you're looking at vulnerable people. They want these people essentially fast tracked through the system. Now, I've already shown you like it's incredibly easy to get this. Now, in her mind, this is not happening fast enough. Here's more from that bill. How to enhance coverage for and access gender affirming healthcare for transgender, two-spirit, non-binary, intersex, and gender diverse people in Ontario. Number 4, how to reduce wait times for gender affirming healthcare in Ontario. Number 6, how to expand insurance coverage for gender affirming treatments, including feminization surgery, chest contouring, and how to adopt informed consent model of transgender care, and how to reduce referral requirements for access to care. In other words, they can't do it fast enough. They need a bill because I guess there's still maybe some roadblocks. I'm having a hard time seeing where the roadblocks are, but perhaps the doctors are not fully on board with this and they want to do this ASAP as fast as possible. Now, I spoken at the Million March for Kids protest. Yeah, just have a look at this photo and let me know what you think. Definitely Joker vibes. I'm kind of sad. When there's a lot of mental health. Let's just put it that way, right? And I met with Aislinn Clancy. She's a member of the provincial parliament for Kitchener, and Mike Morris is a member of parliament for Kitchener as well. And we met right before the protest with Aislinn Clancy, and I talked to her about everything that's happening. And I showed her all the medical documents as well. I've also shown her the books now that Pierre covered, and I even showed her the part about informing people about rubbing two peens together. You can see it highlighted. That wasn't, she didn't want to hear it. She thought things, some teachers may have taken things too far. And I said, I assure you this is approved reading, right? She had a hard time hearing this. And I asked her to basically help us and be on our side. So I've given Aislinn a chance to talk, and she hasn't replied. So if you can view this video as I'm betraying her in order to show you how they betray us. So this is an email that I sent to her, and I said I couldn't help but notice the emotional manipulation and absurd behavior because I have talked to these people, and it's basically all emotional manipulation. They have megaphones; they'll screech in your ear, basically lose your hearing. And I said the main issue I've heard by our opposition was an attempt to raise awareness to prevent sexual abuse. That's basically, we need to show kids perversion and all of this so we can raise awareness about the sexual abuse. Meanwhile, I think this is all abuse, what's happening, right? And I've confirmed the emotional manipulation being used to justify sexuality with minors is absurd. I've confirmed it myself, like I've talked to them. That's why I encourage everybody to go to these protests and just talk to these people. It's contempt against parental figures, which is rebellion. Rising numbers of depressed, suicide, queer trans kids are a feature, not a flaw, when they're converted to a voting political force, aka via her party, right? And I did say that she's been enabling this behavior. She replied, she said, I understand your frustration regarding the experience last Friday. As you know, I was not part of the organizing of the event, but if you'd like, I'd be happy to chat on the phone to understand the feedback I can share with the organizers. I can confirm, obviously, she knows the organizers, and I've seen the Green Party there basically enabling this, and she said, I read your concerns about differing views on how to prevent sexual abuse, right? This is all after I shared this information with her, right? She said, I'll assure you that I will promote ideas and initiatives that are proven in various programs to be effective, not based on my personal opinions. Well, I doubt that because yeah, I showed her the programs and let's just agree to disagree with this one. And then I said to her, it's paramount that we work together for the safety of the kids and acknowledge parental involvement and are affirming our lived experience as parents. You know, Steps need to be taken to include and tolerate our diverse opinions in an equitable manner, even if not everyone can agree to it. In regards to the megaphones blasting in the face, this is not just frustrating, it's straight up disrespectful. We're looking for a respectful conversation to take place. And honestly, it's embarrassing on their end. I'd be embarrassed if I was them and I came to a protest and people dressed up as clowns yelling in people's ears were on my side. I'd probably leave because I wouldn't want anything. But I guess this is a feature, not a flaw. I asked her to chat. It's several weeks have passed by. I haven't heard anything. So yeah, this is the kind of stuff that you can expect from the politicians. They're not interested in hearing what you have to say. So let's recap the school to medical pathways. Stage one, school boards educate and normalize child sexuality and gender in the data mine student demographics to see who's vulnerable. Then the school board invites activist organizations to help the students, and these activists educate the students about medical treatments. And finally, the students are prescribed psychological therapy and drugs through their counseling and therapy and family doctors, nurse practitioners, and they're prescribed body modification surgery. It's crazy. There's only one thing left to do right now. Among other things, obviously, Christina said you need to get involved. But at this point, you need to demand change. The Minister of Education, Jill Dunlop, she's not doing much in terms of this, and she knows all of this is happening. They're progressive conservatives, where all the emphasis is on progressive and nothing left for conservative. You can reach her at that email and the phone numbers as well, and let her know this kind of behavior and these types of organizations involved at the school board is completely inappropriate. And yeah, it's crazy to me that she's not willing to do anything. But at this point, enough is enough, and it's time to take a stand against this. And that's my presentation.
That was terrific, David. Uh, there's some stuff on there that just shocking. You mentioned Youthline, and for people who haven't heard of Youthline, it's been around for a lot of years, and it's promoted in through guidance counselor resources and by third parties in the schools, and has been published on many school websites. And the principal that I worked with when I was running for trustee um, had done a video, and they were through Youthline. There was pathways to information about how to negotiate payment for sex, how if you're a trans sex worker, how to do so safely. Like there's a straight line into prostitution from some of these sites, which was, some of the things I think that these politicians are experiencing is cognitive dissonance, because it's so hard to wrap your head around just how absurd and terrifying this actually is. So for some people, the reaction is that can't be happening. It just can't, and they shut down. And it's unfortunately a cognitive flaw that all human beings have. That if something shocks them out of their model of the world, they will disregard the contrary information.
Yep. That's exactly why I wanted to put this presentation so people can see it for themselves and hopefully they can shock themselves back into reality that this stuff is really happening and they're really pushing this onto kids in schools and it starts at school.
Indeed. Yeah.